If you are over 60 and you take even one prescription pill every single day, what I'm about to share with you could literally save your life before the end of this week. I have spent the last 34 years as a cardiologist watching patients do everything their doctors told them to do: take their pills, follow the schedule, refill the prescription, and still end up in my emergency room with a massive heart attack or a stroke that left them unable to speak, unable to walk, unable to recognize the faces of the people they love most. And what I discovered after 3 decades of sitting across from families in waiting rooms, watching them cry and ask me, "Why did this happen?" is something that most doctors will never say out loud. Some of the most commonly prescribed medications in the entire country are quietly, silently, increasing your risk of heart attack and stroke, and your doctor may not even know it. Stay with me, because what I reveal in the next few minutes could be the most important thing you watch this entire year. I am Dr. James Hargrove, and after 34 years as a practicing cardiologist and internal medicine specialist, I have seen more than 12,000 patients walk through my clinic doors. I trained at Johns Hopkins. I have published research on cardiovascular risk in aging adults, and I have spent the last decade specifically focused on what happens to the human heart and vascular system after the age of 60. And here is the hard truth that motivates everything I do on this channel. The medical system does not always have time to sit down with you and explain the full picture. You get 7 minutes with your doctor, a new prescription, and a handshake on the way out. But nobody tells you what that pill is actually doing inside your body over months and years. Nobody tells you what happens when you stack 2 or 3 of those pills together. And nobody warns you that some of the medications prescribed most often to people your age are quietly damaging the very systems designed to protect your heart. That is why I made this video. Not to scare you, not to tell you to throw your pills in the trash, but to give you the insider knowledge you deserve so you can have a real, informed conversation with your doctor, because your life may genuinely depend on it. Here is what most people do not understand about the aging cardiovascular system. After the age of 60, your body produces roughly 40% less nitric oxide than it did in your 40s. Nitric oxide is the molecule your blood vessels use to relax, expand, and keep blood flowing smoothly to your heart and your brain. Less nitric oxide means stiffer arteries, higher blood pressure, and a cardiovascular system that is already under real, measurable stress every single day. Now imagine adding a medication on top of that. A medication that further restricts blood flow, raises blood pressure, disrupts your heart rhythm, or causes dangerous clotting, without anyone telling you that is exactly what it does. That is not a hypothetical. That is happening right now to millions of Americans over 60. And here is what changes everything. Once you know which pills carry these hidden risks, you can take that information to your doctor, ask the right questions, and potentially make a switch that saves you from a catastrophic event. But here is what nobody is telling you. The 5 medications I am about to reveal are not rare, obscure drugs. They are medications that sit in bathroom cabinets across this country, taken daily without question, by people just like you. Stay with me, because number 1 on this list is going to shock you. Before I get into the list, I want to tell you about Margaret, 71 years old, a retired school principal from Ohio. Margaret had been faithfully taking her medications for nearly 6 years. Her blood pressure pill, her arthritis pill, and something her doctor had added for a sleep issue she was having. She walked 3 miles every morning, ate well, and did not smoke. She was doing everything right. Then, one Tuesday morning, she woke up with numbness on the left side of her face and her words came out jumbled and confused. Her husband got her to the hospital within the hour. Margaret had suffered a stroke. When we reviewed her full medication list carefully, something that is almost never done during a routine checkup, we found that one of the pills she had been taking for years was dramatically increasing her risk of exactly the kind of event she just experienced. Margaret recovered, but she told me afterward with tears in her eyes, Why didn't anyone ever tell me? That is the question this video answers. Drop a yes in the comments right now if you or someone you love takes multiple medications every day. I want to know how many of you are in this situation. Now let me count these down for you, starting at number 5 and building toward the one that concerns me most as a cardiologist. I want you to hear every single one because the combination of these medications, not just the individual pills, is where the danger truly multiplies. Coming in at number 5 on our list are common non-steroidal anti-inflammatory drugs, the ones you probably know as Ibuprofen, naproxen, or the brand names Advil and Aleve. I know what you are thinking. These are over-the-counter. You have been using them for years. How dangerous could they really be? Here is the science, and I want you to hear this clearly. NSAIDs work by blocking an enzyme in your body called EOX2, and when that enzyme is blocked, your kidneys begin retaining sodium and water. Retained fluid raises your blood volume. Raised blood volume raises your blood pressure, and elevated blood pressure, sustained over weeks and months, creates the exact conditions that trigger heart attacks and strokes in people over 60. A major cardiovascular safety review found that regular NSAID use increases the risk of serious heart events by as much as 45% in older adults with existing heart risk factors. And here is the part that makes me lose sleep. Most people taking these pills think of them as harmless because they bought them at a drugstore, not a pharmacy window. Let me tell you about Robert, 68 years old, who came to me after his second cardiac event. He had been taking ibuprofen every single day for 2 years to manage the knee pain from his arthritis. He had no idea it was quietly raising his blood pressure and thickening his blood. When we moved him to a safer alternative, his blood pressure dropped noticeably within 30 days. Your knee does not have to hurt, and your heart does not have to pay the price. Number 4 on our list are a class of medications called proton pump inhibitors. You know them as Prilosec, Nexium, or omeprazole, prescribed to millions of seniors for acid reflux and heartburn. And here is what your gastroenterologist almost certainly never mentioned. Long-term PPI use has been linked in multiple large-scale studies to significant magnesium depletion in the body. Magnesium is not just some supplement people take for relaxation. Magnesium is the mineral your heart muscle absolutely requires to maintain a steady, normal rhythm. When your magnesium levels drop low enough, your heart can begin to flutter, skip beats, or develop a dangerous arrhythmia called atrial fibrillation. And atrial fibrillation is one of the leading causes of stroke in adults over 65. It causes blood to pool and clot inside the heart, and those clots travel directly to the brain. This connection between your heartburn pill and your stroke risk is almost never discussed in a standard office visit, and that silence is costing people their lives. Patricia, 73 years old and a grandmother of 6 from Georgia, had been on omeprazole for 4 years when she started experiencing occasional heart palpitations. Her cardiologist almost missed it, but blood work eventually revealed severely low magnesium. Her doctor called it incidental. I call it a warning sign that never should have been allowed to develop. Patricia is now on a different approach to managing her reflux. Her magnesium is back in a healthy range, and her palpitations have completely resolved. She dances at her grandchildren's birthday parties again. She got her life back. Number 3 will surprise you because it involves a medication that is supposed to protect your heart. Certain blood pressure medications, specifically a class called calcium channel blockers, brand names like Norvasc or amlodipine, when combined with common grapefruit products or even some herbal supplements, can cause blood pressure to drop so suddenly and so severely that it triggers what cardiologists call a hypotensive crisis. Your brain does not get enough blood. Your heart races to compensate. And in older adults whose vascular system is already less flexible and less responsive, that combination can trigger a stroke or a cardiac event within hours of the interaction occurring. But here is what nobody tells you. This is not just about grapefruit juice. Certain cholesterol medications, certain antibiotics, and even St. John's wort, an herbal supplement millions of seniors take for mood support, can cause the exact same dangerous interaction with your blood pressure medication. The medical community has known about this for years, and yet the standard prescription label warning is a small orange sticker that most people never even read. Stay with me, because number 2 on this list involves something that is in nearly every senior's medicine cabinet right now. Write yes in the comments if you are still watching. I want to know you are getting this information because we are getting to the most critical part of this video right now. Number 2 on our list is something that is going to require me to be very careful with my words, because I am not telling you to stop taking it. I am telling you to understand it fully so you can use it safely. The medication is daily low-dose aspirin. For decades, doctors handed out aspirin like candy to anyone over 55, calling it the single best thing you could do for heart attack prevention. And for a long time, the medical community believed that completely. But here's what the science has shown in the last several years, and this goes against what most of your doctors grew up believing. The U.S. Preventive Services Task Force updated its guidelines after extensive research showed that for adults over 60 who have not already had a heart attack or stroke, daily aspirin does not significantly reduce the risk of a first cardiac event. But it does meaningfully increase the risk of internal bleeding, hemorrhagic stroke, and gastrointestinal damage. In other words, the pill millions of seniors take every morning believing it is protecting their heart may actually be increasing their risk of a different kind of stroke, the kind caused not by a clot, but by bleeding inside the brain. I have had patients cry in my office when I told them this. They felt betrayed, and I understand that feeling completely. But the science is bulletproof, and you deserve to know it. Donald, 74 years old, had been taking daily aspirin for 11 years on the advice of his previous doctor. When he came to see me for a routine evaluation, we discovered early signs of gastrointestinal bleeding. Silent, painless, and completely undetected. We made a careful change to his cardiovascular approach under medical supervision, and within 3 months he was stable, protected, and no longer quietly bleeding inside his body. Donald called me a year later to say thank you. Those phone calls are why I do this work. And now, the moment you have been waiting for. Number 1.